Hello and welcome. I'm Valerie Paley, Senior Vice President and Sue Ann Weinberg, Director of the Patricia D. Klingenstein Library at the New York Historical Society. I would like to begin by thanking Louise Muir, our President and CEO, Agnes Sue Tang, Chair of the Board of Trustees, and all of our trustees, in particular, the champions of our library, the late Patricia D. Klingenstein, Sue Ann Weinberg, and Sidney Lapidus. We also acknowledge the generosity of the Mellon Foundation, the Robert David Lyon Gardiner Foundation, Helen and the late Robert Appel, and the National Endowment for the Humanities, along with our Chairman's Council, our members, and our many other donors. None of the work of New York Historical is possible without your continued and committed support. The Patricia D. Klingenstein Library at New York Historical is one of the oldest, most distinguished research libraries in the United States. It holds millions of books, newspapers, maps, manuscripts, prints, photographs, and architectural collections. It is a vital center of research into the history of New York and the nation. Key to that research is the presence of a yearly rotation of scholarly fellows, both in residence and in a short-term capacity. Our fellows are engaged in advancing knowledge as they mine New York Historical's collections for new ways of interpreting the American past. We are most fortunate to have them in our midst. Tonight's program will give you just a taste of the quality of work that is being done. Oases in a Health Desert will last approximately 45 minutes, including 15 minutes for questions and answers at the end, which you can submit at any time via the Q&A function on your Zoom screen. The chat function has been disabled, so please make sure to use the Q&A. After the presentation, we'll get to as many questions as time allows. This evening's program features Jessica Fletcher, 2023-24 Robert David Lyon Gardiner Fellow at the New York Historical Society. Jessica currently works with the New York City Landmarks Preservation Commission as a landmarks preservationist. Holding a PhD from the CUNY Graduate Center, Jessica is an architectural historian whose research has focused on how women adapted and constructed ordinary buildings to serve the needs of working-class women and children in cities throughout the 20th century. She has published in Buildings and Landscapes, Journal of the Vernacular Architecture Forum, Urban Omnibus, and The Baffler, and has contributed to exhibition curation at numerous institutions, including here at New York Historical. In conversation with Jessica this evening is my colleague, Anna Danziger Halperin, Associate Director of the Center for Women's History. Welcome, Jessica and Anna.
Thank you so much, Valerie. And thank you, Jessica, for being here. And thank you to everyone in our audience. I'm so excited to have this opportunity to speak with you, Jess. We've worked together before, and have learned so much from your research for many years now. We share a lot of interests together on social reform and how it impacts women and children particularly. But I think you bring such an important element to your work, to the scholarly conversation that's really novel. And the way that your work is so grounded in the architectural history and in the physicality of how that built environment is shaping the lived and material experiences of the people that are in these spaces. So to kick us off, I just wanted to ask if you could give us a little bit of an overview of the project that you were working on this year in the library here.
Certainly. Maybe I'm going to share my screen. I've got a few slides together so that people can see some of the really wonderful material that I found while I was fortunate enough to be a fellow in the library. And before I start, I just wanted to thank everyone at the New York Historical Society for being so supportive of my work, including Valerie, of course, and Anna and Nina at the library as well, and all of the librarians who helped me to pull material and pointed me towards useful collections. Crystal and Meredith, Jill, Grace, and Gina were all fantastic. So yeah, the overview of the project. So I can show a few images to start and we can talk about them. So this came out of my dissertation research, which I'm hoping to turn into a book, which is about the role of women reformers in campaigning for what were called district health centers in New York City in the first half of the 20th century. These centers were intended to be distinct from hospitals and dispensaries. They were new institutions that offered outpatient care for predominantly working class immigrant mothers and children in lower income areas. And they were offered free and low-cost care. I should also really emphasize these for people who could not otherwise afford low-cost care. So these were spaces that were intended to be a place where you could go and get vaccinations, where you could get dental treatment, where if you're an expectant mother, you could get prenatal care, and you could also get care after giving birth. And they started, you can kind of see the scope. So the map is a map I made to kind of show the scope of these projects across the 5 boroughs. I think for space, I did cut out Staten Island, which I'm sorry to say, but Staten Island does host a few district health centers as well. And it kind of shows you the image in the center. Well, we can talk about more. It was located in the financial district. And it's really typical of the early experiments in district health centers, which were philanthropic, almost entirely led by women, and women made up the majority of the staff and also of visitors to these spaces. And then over time, they convinced the city of the necessity of these health centers as a municipal service that would be publicly funded and permanently kind of enshrined in the city. And that's what you can see on the right-hand side with the Chelsea District Health Centre, which was funded with Public Works Administration funding during the New Deal and is in Chelsea Park. And it still stands. So if people want to make a pilgrimage to it, I recommend it. It was recently renovated and it still looks quite wonderful. And there's a kind of continuity of women's role from the philanthropic 1910s and 20s through to the 30s with the New Deal. A woman named Dr. Margaret Barnard is appointed the head of the Bureau of District Health under Mayor LaGuardia, and she's the one who helps to plan all of these district health centers during the New Deal. So women's role is incredibly strong and really leads these spaces. And I wanted to kind of write about them because it's a real chance to think about how working class people experience the city. Places like San Juan Hill and Kips Bay and Harlem, among others, are really essential to this story. And I wanted to kind of build on the work of social and cultural historians and think about how low-income visitors would have experienced these spaces. And connected to that, I also wanted to think about how race and ethnicity shaped public health programs. I was particularly interested in tracing the racially discriminatory treatments that African-American mothers received and how we can kind of see Northern Jim Crow through the built environment. And like you said, coming from an architectural background, I really wanted to bring to life this built environment and yeah, think about its relevance for today. Yeah,
there's, oh my gosh, so many things to like jump off of and to jump into. It's really fascinating how you can sort of see these 2 examples and see that sort of change over time already that maybe we're seeing. But before we get into those details, can you tell us a little bit about how you came to this topic?
Yes, I was really interested in the history of public housing. And women, of course, played a really important role in advocating for public housing. And so I was researching people like Catherine Bauer and people who are kind of known as houses. And then in the course of researching that, I came across mentions of child health centers and district health centers. And there were sometimes spaces for health included in early New York City Housing Authority projects. And so and then I started to realize that they were freestanding buildings and that they formed this really kind of robust network to this day. People might have become more aware of them during the height of the pandemic. The city used a lot of its district health centers in providing spaces for vaccination. I got my vaccination at my local East Harlem Health Center, and also spaces for COVID testing. And a lot of them are still in use. Chelsea District Health Center on screen is also still in use. So I was really interested in how they came to be, and I should also kind of situate them nationally. This is the New Deal health centers. There are about 14 in all, and then an additional 9 or 10 child health stations. And that's the largest New Deal funded network of health centers in the nation as well. And I was really struck by how women were so central to the story. And, you know, as I worked for the Center for Women's History, being kind of committed to the history of women and the history of gender, I really wanted to explore that in the dissertation and hopefully in the book.
Yeah, that's so interesting to see those continuities and women's role in them, because I think so much of the literature sort of focuses on the medicalization of care, the decreasing role of women. So to see that here is really interesting and provocative.
Yeah, there's a great LaGuardia quote where he calls this kind of work in similar work, municipal housekeeping, I believe. And so there's this kind of belief that women are inherently more suited to this kind of work. And it's completely true that that medicalization, professionalization does push out women, but it's also really striking. I take the title of the talk, Oases in a Health Desert, from a report that was written by a woman, Dr. Eleanor Campbell, who worked in Greenwich Village and was really prominent in the 20s and 30s. In providing a huge amount of healthcare to working class people in kind of the Lower West Side. Yeah, so thinking about how women still found a way into this building campaign is so interesting.
Yeah, and really influential in the landscape of these kind of services.
Yeah.
So what kind of materials did you find in the library during your fellowship?
Show another slide. Okay, great. So the collections were really rich when it came to tracing these health centers. And I really played with the geographic image files that the New York Historical Society has, which are incredibly extensive. And so I thought we could start by talking about what was happening in downtown Manhattan. This is where reformers actually started their work with district health centers. So they started at the tip of the island in the financial district. And photographs and postcards of that era show us the handsome new high-rise office building. So you can see that with this Whitehall building photograph, these kind of lovely in various historicist styles, office buildings, and it was becoming known as a space of white-collar work, where affluent men would commute from the suburbs or from uptown. But actually they were passing by enclaves of low-income communities still. So you can see this image from the New York Historical Society's collection on the right-hand side shows how the office buildings were kind of sandwiching this low-rise landscape that still existed and was home to a lot of immigrants in the period. And the Whitehall building, you can actually glimpse it in the left-hand side. That's the base of the Whitehall building. Then there's the Cunard building, the Bowling Green building, and the Washington building, if people are familiar with those in the background. So you can see that these high-rise buildings are starting to dominate the area. They're kind of reducing light and air to these apartments, which is a prime concern to reformers. In the 1910 census shows that about 2/3 of residents in this district were not born in the United States, and 93% of the population was of foreign descent. So it might have been some were native born but had parents of foreign descent. And the leading national groups were Austro-Hungarian, Irish, and Syrian. So it was about 6,400 people who were in this area. And reformers started to call the area Wall Street's backyard and advocate for it among the kind of bankers who worked in this neighborhood and tried to kind of raise awareness about the poverty that was kind of in pockets still surrounding them. And there were shocking infant mortality rates. The infant mortality rate for this area was 64% higher than the rest of the city. So there was a real focus on infant health, which, as you know, is very common to these kind of progressive era social reform programs. But yeah, I think one of the things that was so great about the collections was kind of the way that it both shows the kind of polite facade of the new office buildings and then lets you kind of peer between them and behind them to show the kinds of spaces where people were living, often not in purpose-built tenements, but just in spaces that had been converted to multi-family housing over time and was pretty dilapidated by this point.
That's really interesting. And there were surveys of like health surveys of downtown too, right? Can you tell us about those histories?
Yeah, so there's a longer history of reformers being interested in this area. And the New York Historical Society has a prevalence of disease map series, which people can actually navigate online. So you can see a lot of the tenement districts were surveyed in the late 1890s. And so this shows us the kind of neighborhood where the reformers started. The blue rectangle shows that buildings that would be developed into the Whitehall building. And then the red star shows where the health center is going to be located. And the pink indicates dwellings, indicates tenements. And it is a little hard to pass the color coding, but these dots indicate cases of tuberculosis, scarlet fever, typhoid fever, and diphtheria. So kind of the major infectious diseases that were kind of ravaging working class neighborhoods in this period. There are a lot of tuberculosis cases and also diphtheria, which could strike children and could be fatal. And this map was created by the Tenement House Committee, which was a group that investigated multifamily housing in the city and helped to campaign for and draft what people might be familiar with, the new law, a 1901 law that regulated, there were previous Tenement House Acts and regulations. This one was notable in its attempts to not only regulate new construction, but also regulate old construction and force landlords to create indoor toilets, even in old buildings. So this was part of a whole kind of tranche of surveys that they did of the area and tenement districts like it. So it had been on the minds of reformers for decades. Yeah.
Yeah. And so you mentioned that little red dot is the center. Can you tell us,
Yeah.
is this the first one, or is this, how did the
Yes,
first
I
district
think
come to
this is
be?
the first one I could find. Yeah, and this is how the reformers referred to it. I can show, we can kind of go into, so this is, there aren't many photos of this building. It's since been demolished, but to the left, you can see the facade of the health center, which was on a very kind of narrow street in this area. And it was set up by the New York Milk Committee, which I know you're familiar with, your work on infant feeding. So the New York Milk Committee was founded by the prominent charity, the Association for Improving the Condition of the Poor, in 1906 because of a Census Bureau report that showed really high infant mortality rates in a lot of immigrant working class neighborhoods. And women reformers got involved in the work of the New York Milk Committee, particularly the prominent suffragist Florence Harriman, who was also an heiress to a shipping and railroad fortune. And she kind of led the charge to establish the first district health center in New York in August 1913. And she was aided by the executive secretary, who was a socialist named Wilbur C. Phillips, who was really horrified by the conditions that he saw in working class neighborhoods. And Harriman herself had crusaded against tenement conditions. So the kind of surveys about tenements also fed into these experiments in health as well. And while she was with the New York Milk Committee, she managed to convince the city's Department of Health to take on some of the philanthropic milk stations and make them municipal milk stations. And milk stations, I should say, sorry, were these spaces where mothers could get clean milk. There were issues with milk being improperly stored and spreading infectious diseases. So she was really successful in kind of getting the city to take more responsibility for the health of working class residents. And she and others kind of spearheaded this venture. And so it was a narrow 4-story brick building. And it had actually originally been constructed as a warehouse in the mid-19th century. But over the decades, it had shifted to residential use. And in the 1910 census, I found that 2 families lived in the upper floors. One was Syrian, the other was German and Austro-Hungarian. And it's interesting as a kind of profile of the neighborhood, these families were quite typical of the neighborhood. Both the husbands and wives of the families worked. It wasn't a kind of family setup where there was just a male breadwinner and the wife stayed at home. And that was quite common to this area. And one couple worked as street peddlers. And the husband was a porter and the wife was a cleaner in office buildings in the neighborhood. And that was a very common occupation for women, to be the cleaners of the new office buildings. So these were exactly the kinds of families that the center wanted to help. So when they entered, the ground floor had a waiting room and an examination room and a couple of other clinical spaces. It was staffed with 1 male doctor and 1 female doctor, and it appears that the female doctor worked more frequently. So when you entered, you were likely greeted by a woman, and there were several female nurses. They also had a Syrian woman work as an interpreter for families in recognition that they were working in a multilingual neighborhood. And mothers were really encouraged to visit the neighborhood for prenatal checkups and to get advice on child rearing as well. And so they were kind of drawing on the examples of milk stations and settlement houses, but trying to expand into more preventive healthcare for mothers and children. It's quite a modest spatial intervention at this point. It's quite small, but over the course of the 1910s and 20s, as we'll see, they occupy far larger quarters in buildings across the city.
That's really interesting. And what you're saying about the demographics of the
Mhm.
neighborhood. I think a lot of times when people think about who these kind of early health centers and early sort of places of social benefits distribution, who they were serving, people usually are thinking about immigrant families from Southern Europe, from Eastern Europe. But what was the relationship between these early health centers and African American New Yorkers?
Yeah, that's a really great question. This is a building which was later used as a health center for African Americans, which we can talk about. So the Association for Improving the Condition of the Poor, so the same organization that had started the New York Milk Committee, did also set up one of the earliest centers, health centers in the city for Black New Yorkers in an area called San Juan Hill, which people might be familiar with. It's the area that runs roughly from 59th to 66th Streets and between Amsterdam and West End Avenue. Historically, was a Black and then a Puerto Rican neighborhood, and was demolished for various urban renewal projects. So now it's kind of the area around Lincoln Center that we associate with Lincoln Center. So these are the spaces in which one of the earliest health centers for African Americans the earliest health center was set up for African American New Yorkers. It's really important to note that it was very poorly funded in comparison to the health centers that the Association for Improving the Condition for the Poor set up for white immigrants. So there's a kind of immediate disparity in the resources that are allocated to these two spaces. And this is kind of very kind of evident in the reports, but I think it's an interesting, the building itself has a very interesting history. So they set up what we're seeing on the right-hand side of classes in an industrial school. It was called the Henrietta Industrial School. Anna, again, knows this building. I believe some of these images are in the women's work exhibit.
The top one on the right is in women's work. It's pretty large on the wall. So if anyone watching is coming through the gallery, that should be a familiar image.
Yeah, exactly. So the industrial schools were set up to provide vocational training for working class young people. They were meant to kind of encourage habits of industriousness and supposed moral virtue. And they were also just pragmatically training people so they could immediately work upon leaving school. Usually in the daytime, there would be normal Board of Education classes. And then in the afternoon and evenings, there were vocational classes like sewing and housekeeping and bookbinding, a kind of range of different things. And as the kind of photographs suggest, these were quite regimented institutions that really had disciplinary intentions for the young people who attended them. There's this kind of moral panic about young people congregating in places like dance halls and cinemas, and this wish to keep them in reform institutions. So the place that the Association for Improving the Condition of the Poor chooses for their first health center is quite a fraught one, one with this history of discipline. And they do decide to set up in this neighborhood because of a study from 1915 that shows that babies in this neighborhood are dying at triple the rate of the rest of the city. So just astonishingly awful infant mortality rates. And they kind of move around the neighborhood. And then in 1918, they set up in a single room in the Children's Aid Society's Henrietta School. And then eventually they expand to 2 rooms, but it's a very kind of constricted space. Yeah.
Yeah, so that's so interesting with this fraught space within the community. How then did African American women in the community make use of this space?
Yes, I think there's another image that is in the women's work.
I love this so much.
Which is a wonderful photograph. And I think it really speaks to maybe a dual history or a very complicated history of this health center. So it's important when we look at this photograph to know a few things about how the health center operated. And there's a wonderful book by a historian named Tanya Hart called Health in the City, which goes through the history of this center and is really fascinating. And she shows that white staff took dominant positions at the clinics in their early years. And even though statistical reports showed that the high death rates in the neighborhood were due to things like tuberculosis and infant diarrheal diseases. After 9 months of working in the neighborhood, the charity shifts its focus to venereal diseases. And this is really based on this racist understanding that Black women are more prone to contract things like syphilis. And this kind of racial prejudice means that African-American mothers who attend this health center have to receive venereal disease tests. And it's also important to note that these tests were often inaccurate in this period. The historian of medicine, Alan Brandt, has written, "The suggestion, knowledge, or even inference of immoral behavior by a patient may have led to a tendency to identify non-specific infections as venereal." So there's this real bias in diagnosis. And then the treatment of these diseases can be semi-toxic in this period, the chemicals that they're using. So it's really a kind of, in some ways, again, a continuation of this disciplinary, unpleasant space. This kind of the women who attend the center are kind of treated in a way that is really unconscionable in some instances. And also, as I was kind of alluding to, there's quite limited space and staff in comparison to other centers, and we'll go into kind of a couple of the other centers to see how much larger the other quarters were. So the Columbus Hill Health Center had very limited on-site clinics. There are accounts that I found in the archives at Columbia, actually, of African-American mothers trying to access health services and being referred to as many as 6 other places in order to get all the different kinds of services they needed. So this whole idea of this kind of utopian idea of having these centralized places in working class neighborhoods where women could go and receive healthcare is really undercut in this instance because of this racial discrimination, this underfunding of this center. But I think also the photographs show us how Black women really appropriated these spaces. Black nurses made up the majority of the staff, although they had a white supervisor until the late 1920s. And so I think in this image, we can also see the efforts that the staff have gone to make a somewhat welcoming space. We see the little animal cutouts that are on the wainscoting. We see these clean white curtains creating privacy. We see all of the women who are kind of well-dressed and the kind of orderliness of the center. It's not too crowded. We are seeing 2 children being looked after at once. That's pretty common for this period. We might now expect when we receive healthcare to have privacy, but there was a lot of kind of congregate settings for healthcare for working class people in the early decades of the 20th century. So I think this photograph is really interesting and kind of uncovers how African-American staff members appropriated the space, took something that was quite meager and made a kind of dignified setting for children to receive healthcare. Yeah, and there's also a kind of politics of respectability happening in the image. You know, the women are all kind of averting their gaze and are well dressed. So it's also part of this broader strategy that Black women kind of developed to refute racist stereotypes as well.
Yeah, it's such an interesting image. I think there's so much we can read into it. So we've talked about downtown and we've talked about San Juan Hill. Where else in the city did these health centers develop?
Yes, really in every tenement district. I think Little Italy is another prime example, and it's connected because the Association for Improving the Condition of the Poor also set up this health center for Italians in another old industrial school building, which you can see on the left. It's an industrial school on Mott Street. But unlike in San Juan Hill, where they didn't pay any rent actually for their rooms, that was part of the agreement that they had with the charity that owned the building. For this building, they paid $20,000 to buy the building, and then they paid $16,800 to renovate the building. And they got the architectural firm of Renwick, Aspinwall, and Tucker to do quite extensive renovations to change it from a schoolhouse into a community and health center. And it contained large office spaces for staff. So the women who worked there could kind of enter and immediately be in their own space, a space of professionalization. You know, they're early social workers and nurses, and they get their own quarters in this building. And then there's space for multiple health clinics, for a dedicated space for a separate dental clinic as well, and rooms for neighborhood clubs as well. So it really becomes a kind of hub for the neighborhood. It is, I think, important to note, of course, in this period, historians have talked about the idea of a variegated whiteness, is Matthew Fry Jacobson's term. The idea that groups such as Italians were understood as racially different from and inferior to Anglo-Americans. So there's still a kind of eugenicist logic behind choosing Little Italy, which is home to many Southern Italians in this period, as the site of the next health center. But having said that, in comparison to the African-American Health Center, they receive far more funding. They're in newly renovated premises. There is still this disparity in the kinds of care that you could receive as a European immigrant versus an African-American New Yorker.
That's so interesting. So a lot of times, in generally, when we're talking about the history of social reform, but also specifically in some of the cases, you know, the materials that we have at the Patricia D. Klingenstein Library are from the perspective of philanthropists, right? A lot of these images are that you're showing us, right, are from the Children's Aid Society. So how, as a researcher, do you approach trying to get the sort of working class experiences of these reform? How do you try to use the collections to get that other side of the story, if you will?
Yeah, I think there are so many wonderful examples from different social and cultural historians of kind of reading these artifacts against the grain, taking reports that were written by middle-class reformers and trying to understand it, take a different understanding from them than the often kind of moralizing paternalist or maternalist ideas that they had. And so I've written a couple of blog posts about this for the blog, but this was an amazing find, the Mott Street Industrial School and Visitors book. So this is, just to make clear, this is a visitor's book written by a visiting nurse who worked for this school that later became a health center. So we're going back a little bit in time, but I think it's a really interesting object when we try and think about how we can read things against the grain. So visiting nurses were they came out, they were a kind of early social worker. People are probably familiar with Lillian Wald and the Henry Street settlement, which developed a visiting nurse program where often middle class, upper middle class women would go into working class homes and offer different kinds of health services to those people. This visiting nurse was named Emma E. Smith. I did a bit of census research, and she was native born but had German parents. And she was a widower, so she clearly had returned. She was in her 40s by this point, and she had returned to work after the death of her husband, is the kind of most likely trajectory. Usually women might work as nurses once they were young, and then once they were married, they would tend to leave the profession. So this is a really fascinating book. It's, as you can see, alphabetically ordered. And she is called to she is instructed by the school to visit the homes of students who have behavioral issues or a high rate of absence normally. So she's normally entering these apartments, these tenement apartments all over Little Italy, when the family is in some form of crisis. Usually what she's encountering is a father has fallen sick and cannot work. And so it's often that the eldest daughter is asked to stay at home and look after siblings while the mother tries to work to supplement the families to bring in income for the family, or the children themselves are being asked to work. So she's kind of entering all these kinds of families who are experiencing really difficult circumstances, and she gets to decide whether they receive aid from the school or not. So there's this quite stark power relation there in terms of her being the one to say whether or not a family is quote unquote deserving of aid. And this is something that she often kind of opines on in this document. She often links it to the cleanliness of the home and of the family. Might be hard to make out her writing in this page, but in the middle she says home poor but clean. And that cleanliness is to her a really important signifier of whether a family deserved aid or not. So I think that this was a really fascinating example of a kind of dynamic that historians have talked about, of the ways in which aid recipients were classified as deserving or not deserving of aid on the basis of things like whether they seemed willing to work, whether their homes seemed clean to reformers, and then trying to read these accounts against the grain to think about reasons why, if you are a family that is undergoing a particularly difficult time and then a person drops by unannounced, there might be multiple reasons why your home might not look particularly tidy at that point in time. And there are also, I think, in this period, a lot of the buildings in Little Italy are fairly run down. There's a lot of kind of landlord negligence. So often reformers would complain about things like smoke having stained the walls of the apartment. You couldn't necessarily rely on your landlord to whitewash your your apartment at that point regularly, or indeed now. So this was really these kind of assessments of whether families deserved aid or not were really classist and also often kind of biased against the practices of immigrant families more broadly. There's a real kind of hostility and misunderstanding about why a family might keep a child home that recurs in this book. And so I found it really kind of fascinating to read it and think of ways to kind of think about these stories differently. And I should also say she actually lived herself in an industrial school. So industrial schools often provided spaces for visiting nurses and janitors and teachers to live. So she lived really close by on East Broadway and really close to the Henry Street settlement. So there's an interesting kind of also kind of group of visiting nurses who were all in this area together. Yeah.
So interesting.
Mhm.
Just a reminder for the audience, we are starting to get close to the, let's say, 2/3 point of our time. So I have a couple more questions for Jessica, but while we're starting to get near to the end, if you have any questions, please submit them to the Q&A function, and I will try to cede the floor to them if I can stop asking myself. I also in thinking through your work, I'm so interested in your periodization, because the New Deal is sort of squarely in the middle, right? Oftentimes work, it's sort of, it either leads up to the New Deal or it picks up with the New Deal. So how does the New Deal figure into your story? How does the New Deal affect health centers?
Yeah, it really revolutionizes health centers. And I found a really lovely image in the collections from this a collection of WPA prints that the New York Historical Society has, showing a health clinic from the 1930s. And so it's hard to overstate how much the New Deal changed health centers. It created huge amounts of funding and purpose-built centers across the 5 boroughs. As I said, there were 14 health centers, I think about 9 child health stations, and other things like health laboratories and office buildings that were built with that money. And there was also some building after the New Deal, which I didn't get into, but I tried to kind of extend my periodization so that I was thinking about how women experienced these centers. It made the centers far less ephemeral. Often the very first district health center that we talked about was open for, I think, a year or a year and 6 months before it closed. Places were constantly moving and rents would change, or a building would be demolished. So there's a lot of kind of ephemerality, and that leads to situations like people being referred to a lot of different places or just not really knowing where to go. And so the New Deal kind of creates a much more stalwart stock of buildings that are devoted to healthcare. And it also kind of makes it a municipal responsibility. There's a sense of civic responsibility, which is obviously really radical in the US, which doesn't have a national health system. And I should say, actually, originally this was a transatlantic project, which was kind of stymied by COVID, but I was comparing it to London because there's a very similar pattern in London of kind of smaller philanthropic and some municipal health centers that are built in the 20s and 30s. And then there's the shift to the NHS. And I was kind of interested in comparing the two, but I ended up focusing on New York City. Yeah, so I think it really expands the program, centralizes the program, it makes the program more reliable in a lot of ways. Yeah, and the buildings, I hope that people start noticing them if they live in the city, because you do see them a lot. They start to pop up wherever you go. You start to notice these district of health buildings. Yeah.
That's so interesting. And as someone who did comparative work, I love that it was originally a comparative project.
Yes.
I think there's so many interesting ways that could be, and maybe someday it will become a comparative project once again. So I know, like, in our post-Dobbs world, we often are thinking about the history of birth control and reproductive justice issues. But during the time of these, that these districts' health centers were being developed, birth control was also a huge hot button issue. How did it figure into the services of these health centers?
Yeah, that's a really great question. And unfortunately, I think you can kind of see the seeds of the precarity of access to birth control and abortion in the story of district health centers, because the leaders are incredibly reluctant to include contraceptive advice and, of course, abortions being illegal for much longer. So aid for women, it was predominantly examinations before and after pregnancy. It was a lot of advising women to have doctors attend their deliveries rather than midwives, which is that kind of professionalization piece that you were talking about. These are some images of the poster for the original Margaret Sanger's birth control clinic that she opened in 1916 and was only open for 10 days before it was shut down and staff were arrested. So district health planners are very cautious because they saw public healthcare itself as being something that was very precarious, and they were worried that by including services that were seen as controversial, they would further create precarity. There are interesting kind of like glimpses in the archive of the network of birth control centers, in particular in the 20s and in the 30s. You occasionally come across a letter from someone complaining that they can't get birth control at their local health center or advice about it. Oh, Anna, did you?
Oh, no, sorry.
I think you were interjecting.
No, I was just saying interesting.
Yeah, so there are occasionally these letters that come up, and sometimes the staff respond and say, we actually do think that women should have access to reproductive advice. This is the place that we refer them to. So you start to see there's a kind of geographical separation of the services, the birth control, and certainly abortion services in the city, which I found really interesting. I think Joanna Schoen's book, Choice and Coercion, is really great on talking about this separation of birth control in particular from maternal and child health services was fueled by this real fear that they would be defunded altogether. So unfortunately, there's not much until the kind of post-war period, really. And then it's also problematic because there are these kind of eugenicist reasons why the state starts to get involved in offering birth control. Yeah.
Interesting. So I'm going to turn to audience questions now, and we have one about the 5 Points neighborhood. Can you talk a little bit about how these health clinics, how these health centers figured into the 5 Points neighborhoods?
That's a good question. I'm trying to think. There are certainly a lot of kind of more ephemeral health centers that spring up, and I started to there were just so many attempts to create these small kinds of centers that I ended up focusing on the larger examples, which in the end didn't so much occur in that neighborhood. I think that the closest one is probably kind of, thinking about Mulberry Bend, the Little Italy health center did serve some of those people. A lot of these health centers you didn't necessarily have to be a neighborhood resident to receive care. So you could also travel to them. But I think that it was kind of smaller and more ephemeral from what I could find in that area. So I focused on the kind of larger examples where they were taking over entire buildings. And that was, yeah, kind of focused in the one that I discussed on Mott Street in San Juan Hill, and also in Greenwich Village and Kips Bay. Also, you see really large ones as well. Yeah, but it's a good question.
Yeah, that's a great question. We have another question about, are any of these records available to the public in person or online? And it's an interesting question. Right now, the library is closed to the public because of construction. Although that won't be forever, and it is possible to make a research appointment in the library. But Jess, based on these records, which collections are online, and a lot of them are. I know, especially the Children's Aid Society, a lot of them are. But
yeah, I was going to say the Children's Aid Society, if you are interested in that topic in particular, I mean, so much has been digitized. It's really quite amazing. If you go through the finding aid, you can find a lot of the photographs in particular, and some of the reports as well have been digitized too. And then the geographic files are not accessible online, but there have been a lot of these kind of images, and the map series, which I mentioned, is online. Yeah, and also Columbia's Rare Book and Manuscript Library has some additional material about the Columbus Hill and the Little Italy health centers too. Again, more photographs have been digitized. So I think photo research is actually it's quite good to do online. And I think some of the Department of Health early reports have also been digitized by the municipal archives too. So there's a kind of hodgepodge of resources there, but there is quite a bit online.
yeah, the New York Academy of Medicine also has the New York Milk Committee, some things digitized as well. But our Children's Aid Society ones, there's like this giant Flickr site, and some of those photographs are just beautiful. They're so amazing.
Yeah, definitely. No, it's a
I
great
sometimes get lost, like looking through the albums.
Totally. Yeah.
Yeah. Well, I think unfortunately we have run out of time. I want to thank Jessica Fletcher for being with us today, and to everyone here for joining us. You can sign up for our mailing list and also follow us at nyhistory.org to get the latest on Fellows Talks just like this one, as well as Center for Women's History programs and events. To add my Center for Women's History plug as well. And finally, the New York Historical Society is currently open Tuesdays through Sundays. You can reserve your timed entry museum tickets on our website. We hope to see you on Central Park West to view our exhibitions, Lost New York, Beatrice Glow, when our rivers meet, as well as women's work, in addition to our numerous other offerings. Thank you again, and have a wonderful night.
Thanks, everyone. Thank you.